In a world where we live with inserts, we are at risk of being stung by any of them. So I want you to join us educate ourselves on some immediate action to follow in case we get stung by a bee, wasp, an ant, and even centipede. But first, you need to save this video, as a day might come you will need it. Bee stings can cause different reactions, from mild temporary pain and discomfort to significant swelling and a severe allergic reaction. When it comes to first aid for bee stings, begin to remove the sting in the skin by sliding or scraping your fingernail across it, rather than pulling at it. After the removal, wash the area and apply an ice pack to reduce the swelling. And lastly, if there is significant pain and swelling, opt for over-the-counter pain medication such as paracetamol or an antihistamine. These meds may give some relief. Always remember to initiate first aid immediately and with speed. Note: if the person has an allergy to bee stings, they can experience anaphylaxis. If this occurs, they will need an adrenaline injection. If someone has multiple bee stings or in a serious reaction after a sting, follow these first aid techniques instead. First thing to do is remove the sting as soon as possible and immediately call for help or an ambulance for the victim. Whilst waiting, administer adrenaline, only if it's used by the person for bee stings, and then keep the person lying down and completely still until the help or ambulance arrives. But if someone has been stung in the mouth or stung many times in a single incident, that is more than 10 times in adults or more than 5 times in children, they need to be taken to the hospital immediately. Again, always remember to initiate first aid immediately and with speed. By the way, if you are loving this, remember to hit the like button, share your opinions in the comment section, subscribe or follow the channel, and share with others. Unlike a bee, which can only sting once, wasps can sting repeatedly. Wasps emit a scent chemical that alerts other wasps to attack. Wasp stings have certain features, including burning pain, raised lump, redness and local inflammation. Around 1 in 10 people who are stung 2 or more times become allergic, which means they will experience severe reactions to any subsequent stings. Now, follow these first aid techniques after a wasp sting. Unlike bees, wasps do not leave a stinger that needs to be removed. The immediate action is to clean the affected area with soap and warm water. After that, apply a cold pack or ice to the area to reduce swelling and pain, but if there is significant pain and swelling, over-the-counter pain medication such as paracetamol or an antihistamine may give some relief. Always look out or be alert for signs of anaphylaxis, which is a severe and life-threatening type of allergic reaction. And if still there's a prolonged swelling at the site of the sting after antihistamines, seek medical advice. Note: injections should be given by an expert. Thank you. Again, if someone has been stung in the mouth or stung many times in a single incident, that is more than 10 times in adults or more than 5 times in children, they need to be taken to the hospital as soon as possible, or call an ambulance if necessary. Always remember to initiate first aid immediately and with speed. Like bees and wasps, ant stings also carry a high risk of severe allergic reaction. First aid for ant sting is by 1. Washing the area and applying cold pack to reduce the swelling. 2. Administer over-the-counter pain medication such as paracetamol or an antihistamine if there is serious pain and swelling, as this may give some relief. And 3. When the person experiences anaphylaxis due to an ant sting allergy, an injection of adrenaline needs to be administered. I repeat again, injections should be given by an expert. By the way, if you are stung by a centipede, it can be treated by applying an ice or cold pack to the site. This helps to reduce swelling. That's all for now. Thank you for your time. I hope these first aid tips can be of an assistance to you. See you in the next first aid tips.